Thank you for seeing me on such short notice, Doctor.
That's OK. Come on in, have a seat. I'm Dr. Graham. How can I help?
Right, if you look at my history, last year I had this case of a similar situation like this where my mouth lost skin. I couldn't eat very much, but compared to it now, that was like a 3 or a 4. This started off again on Tuesday or Wednesday.
Yes.
I have lost skin everywhere. I haven't eaten a solid meal for 4 days.
Yeah.
I went to the pharmacist. They recommended something called codeine with paracetamol.
Yes.
Which the pain has subsided, but even now, here I can still feel that constant throbbing. My head is hurting. But this hasn't happened for over a year now.
Yes.
I don't know what's happened.
OK, and do you have this kind of problem anywhere else on your body?
No.
No. You
Nowhere
don't have
else.
any problems, genital ulcers or anything like that?
What do you mean by genital ulcers?
Well, you've got mouth ulcers, that's what these are. They haven't got anything on your penis or anything like that, no.
Nothing at all.
Very rarely there can be a connection when it's quite severe, but it doesn't sound like that's the case.
No.
Can I have a look in your mouth?
Right.
Yeah?
The only thing, Doctor, my mouth probably smells a bit bad.
Oh, don't worry about that.
If you want to probably put on a mask or something, at least it makes me feel a bit better.
No, I'll be fine with that. There's quite a lot, aren't there? And then open up wide. Yeah, you've got a lot on the roof of your mouth and on the back of your mouth as well. All right, so most of the time, this is due to a viral infection that we can't really name. But just occasionally, it could be that this is a viral infection called herpes. Have you heard of that?
Isn't that an STD?
It can be an STD, yeah, but it doesn't have to be. OK? And I'm just wondering whether it would be helpful just to rule that out.
Just to run this by you, though, because I haven't been actually sexually active for about 8 months because my girlfriend has a long-distance relationship.
It's probably nothing to do with sex, this, OK? So there are 2 sorts of herpes.
Right.
There's genital herpes, and then there's herpes, which is just like really bad cold sores.
Right,
OK? And that is probably all it is, but it's really bad, so I think we need to
do something,
investigate it a bit more. OK, it's a little bit of a rough swab, so it makes it a bit sore, I'm sorry.
No, as long as it helps you find out what's wrong, I'm cool with it.
If you could lower your lips down, I'm just going to do it along here, because you've got quite a few examples there. OK, that's great, that's done. OK, so that will take a few days to come back. If it's negative, then it hasn't really progressed us as to why this is happening. But some people do get terrible mouth ulcers. And there isn't very much that helps with mouth ulcers.
I've got 4 gels which I'm constantly using.
The problem is that as soon as you put them on, your mouth washes them away. If over the next week or 2 it's clearly just getting much worse and you're suffering a lot, then just come back in. OK?
Doctor, thank you very much.
That's all right. Good.
See you later, ma'am.
Yeah, bye now.
Oh, God. Thank you.
How are things?
Yeah, same. How's my X-ray? Same?
They're normal.
Yeah, I thought so. The tablets aren't doing anything. I really kept on with them and the side effects were fine. They went down.
The pregabalin.
Yes.
Yes, yeah.
And it's just still got this bloat and then this twisty kind of pain. I don't know what to do.
And how often does the pain come?
It's always there, just hanging around in this little patch. Like, I just don't know what to do now. Last week's been quite bad. Right. I haven't really slept.
What do you want to do you think?
I don't know. I do some kind of... I know there might not be... Sorry. Oh, God's sake. I'm just fed up and I just want this pain to go.
Yeah.
I can't do it anymore.
I mean, do you think the bloating is a big thing?
Yeah, massive. I'm so sick of it. I just look like I'm pregnant sometimes. Like, that's not... I never had this issue before.
OK.
Something weird is going on. Ugh.
It's important for us to think how many tests we're going to do.
Yeah, of course,
Because I think tests can be quite difficult for you. The more we go through them, they get more invasive as well. And there's more radiation and that sort of thing, which isn't good either.
Michaela is quite a new patient at the practice. She has sadly been suffering with pelvic and abdominal pain for approximately 3 years. She's been investigated quite significantly, but nothing has been found to help us work out the cause of her pain as yet.
You know, I think it's really reassuring that all your bloods were normal.
Yeah, that's good. Good.
And your X-rays are normal, so it's good there's nothing sort of...
There's nothing really bad.
But it's also really frustrating, isn't it, that we can't say, that's it.
Yeah, I know. So, I don't know what do you do now?
I think what we need to think about is helping you with the pain, really. If we got the pain better controlled,
Yeah, definitely.
I'm not saying get rid of it.
Yeah.
What our aim would be to manage it better.
Okay.
And I wonder if we ask the pain clinic for some help with that.
Yeah.
Because pain is a strange thing. The pain pathways are really tricky, and it's how we feel in ourselves affects the pain, and it's a bit of a vicious circle.
Yeah.
You know, if we can feel quite low and stressed due to pain, and then that can make the pain worse
Yeah,
as well.
definitely.
So with the pain clinic, they haven't got any different medicines than what we use, but they look at it in different ways.
Okay.
So what are your bowels like? Do you have any
day.
diarrhea at all?
No, never have diarrhea. If anything, it's not like constipated, but like it will usually be every day or every other day. I'll go, and then sometimes it will feel like it's not quite out. Like I don't know, it just feels heavy and just I don't know.
Okay. Why don't we try some fibre gel?
Okay.
Have you tried that before?
No.
So it's a sachet, it comes,
Okay.
and it's just a fibre that you add to some squash or juice
Okay.
or water. I mean, I still do wonder if it could be
Yeah.
an irritable bowel type thing.
Yeah.
Okay. And it just helps the stool go through a bit more easier.
Okay.
Okay. I think it's worth trying
Yeah.
for a couple of months and
Yeah.
see if that
I'll
helps.
try,
Yeah.
definitely.
Okay.
Yeah.
There we go. Okay. So come and see me in a couple of months to see how you're getting on
Okay.
with this. All right, and I'll refer you for pain clinic in the meantime.
you.
All the best.
Thank you.
Bye-bye.
How can I help?
It's about my leg. I want to see if anything can be done about the scar,
Ah,
because it's quite hideous. And all down the back, it's just hanging there.
yeah. How's the sort of numbness in that foot? Is it about the same?
I've got no improvement there.
No.
It's still numb.
And the operation was back
December
15.
15.
Yeah.
Yeah.
So the level of numbness, has it got any better or is it about the same?
It's still the same as when I had it done.
So I don't think that's going to change.
No.
Lorraine has a complex past medical history. At the age of 51, she was diagnosed with a lymphoma. During the course of having chemotherapy, she developed a clot in her right leg. She then went on to develop what's called compartment syndrome and an acute ischemia of the leg. What that means is that the clot expanded and she had to have an emergency procedure called a fasciotomy, whereby you literally slit things down in the leg to release the pressure. And it's an emergency situation, otherwise you're at risk of losing the leg. But you did have a bit of what we call foot drop after the surgery.
Yeah,
and that's
I still got foot drop, but before I couldn't even lift it up.
No.
You know, I've now got control to.
You seem to be
Lift it
walking
up.
more easily than
It's a bit
before.
easier to walk, but I can't walk very far at all.
Well, look, it's
But I
got
think I've
better, hasn't it?
yeah, I think
From
I've
what you were
given up.
going through, look how far you've come.
Oh, yeah. I mean, I couldn't even walk in the beginning. Now I can walk a little bit. And, yeah.
When's your next haematology appointment?
Next Friday.
And are they happy with everything that's going on?
Yeah.
They're just monitoring you, aren't
Yeah, I go every 4 months now, so
they? Okay.
I hope just every 4 months. That's all I want.
What are you hoping that they do?
I'm just
improve
hoping.
improve the appearance.
Yeah, because all this flesh here is just so loose.
Yeah.
I was wondering if maybe something could be done for it to be brought together, because I don't really want skin graft after what I went through with the last one.
Do you moisturise the skin?
I do. I use bio oil on it, which they say for scars,
Yeah,
don't
and just
they?
general moisturising.
Yeah, I use moisturising creams and I use bio oil on the actual scars.
Okay. It's a difficult one, Lorraine, because firstly this becomes a cosmetic issue,
That's what I was wondering.
which secondly, with your medical history and with the tablets that you're on,
Yeah,
I don't think anyone will want to go near you unless they have to. I'm being completely honest.
yeah.
And I'm not sure there's much that can be done there. If you open up other scars, you create scars on top of scars, and it
Yeah,
doesn't really help it.
yeah. I mean, would anybody be prepared to see me to discuss it, do you think? Because it is ugly, isn't it?
Firstly, on the NHS side of things, we'd have to apply for funding for you
Yeah.
to be seen, and I don't think we will get that.
Yeah.
Because I'm not sure that there's much that we can do. On the whole, cosmetic surgery is not funded by the NHS. There are certain exceptional circumstances whereby a committee looks at the evidence provided to make a decision on an individual basis. So, for example, if somebody is suffering from severe emotional and functional impairment as a result of their disfigurement, this may be looked at in a different way. I can discuss it with a colleague of mine.
Yeah.
If you're happy for me to take a picture.
Yeah.
Is that okay?
Yeah, that's fine.
It's nice to see you smiling as well.
Yeah.
You're happier in yourself, I think.
Yeah, oh gosh, I've come a long way.
You have come a
Yeah,
massively
from
long
what
way.
I was, because...
So leave that with me, so to speak. But I can't promise anything.
No, OK, that's fine.
Are we supporting you enough? Do you need any further counselling with what's happened, or you do feel you're happy?
No, I'm OK. I've had loads of counselling. I'm not on antidepressants anymore. I mean, I still get down days. Of course you do, but I think anybody who hadn't been through what I've been through gets down days, don't they? But
I think you're
on
an
the whole,
inspiration, actually, of how well you've done.
on the whole, I'm not doing too bad. I don't work, obviously, now I've been retired. I just try and keep myself busy.
OK, we'll leave it at that for today, if that's OK.
OK, yeah, that's fine.
Nice to see you.
Yeah, and you. Thanks very much.
All
Thank
right.
you.
Bye-bye for now.
Bye.
Hi there.
Hello, all right.
Robert, you're looking uncomfortable.
Yeah, it's my legs still playing up and my back. I went to see Saidmead.
Yeah, these are the nerve conduction studies, aren't
Yeah,
they?
they'd done all that, and they said they was going to write to me, and I haven't heard nothing.
No, OK, I have to say I haven't heard anything either. I'll write to the neurologist and say, look, it looks, you know, this chap's had all his tests done.
Yeah.
They did the electrical tests on your arm and your leg,
They've
did
done
they?
it on my arm and my leg, yeah.
Yeah.
Oh, just down in the dumps still, really.
Well, you are, aren't you?
Yeah.
Let's talk about that, because that might be more important even than the pains, isn't
Yeah.
it? So I saw, since I last saw you, I gather you were evicted from your
Yeah.
parents' council house, is
Yeah.
that right?
Yeah.
And where are you living now?
I just stay with my sisters
Yeah.
4 days a week,
OK.
and then I just stay with my daughters just on the weekend.
So is that the long-term plan, or are you trying to get something
I'm
else?
trying to get somewhere. I went for a property and they said I was unsuitable.
You're not in work now?
No,
How's it working out, staying with your relatives?
not very good, really. But I've got nowhere else, so just got
Yeah.
to do that.
Yeah. And you're looking very down, and you said you feel quite down.
Yeah.
Tell me about that.
Well, it's just the loss of mum still going to me. And my sister and my dad. It's just, everything's just getting to me at the moment.
Had you thought about if there's anything I could do to help you?
Well, you give me this letter to ring up about when I was down in the dumps before.
For the get some counselling?
Yeah.
Yeah.
They rang me back and said I can go to a meeting,
Yeah.
which I went there and they was talking to me and
Yeah.
everything like that. And they give me the number. They said any time you just ring. So
I think it would be worth you ringing maybe and asking for some one-to-one
pain her
counselling.
now with that lump as well.
Yeah, OK. Let's just stick with your mood for a second, because I don't want to lose this opportunity to talk about that, really.
Yeah.
So these were the people you rang, wasn't it? Bristol Wellbeing Therapists.
Yeah.
I would encourage you to give them another ring, actually.
Right.
That's the number.
Yeah.
And say that you went to a group session before,
Yeah.
that you're very down in the dumps, and that maybe some one-to-one counselling would be
Yeah.
helpful, and they'll take that on for you.
Yeah.
All right, so I'd
Yeah.
encourage you to do that. Are you still taking the antidepressant that you were prescribed by my colleague?
Yeah, yeah.
Can I suggest, if you've not had side effects, but obviously you are still quite depressed, maybe we should put that dose up to 100 milligrams and see. OK?
Yeah.
You're probably running out of it fairly soon, actually, aren't you?
Yeah.
So I'm going to give you a higher dose of the antidepressants. So I'll put a prescription for some of that through to the pharmacy next door. You're going to contact those people. I'm going to write to your neurologist. There we go. All right.
Yeah.
I think that's covered enough for today. But I'll come and see me again in a month.
OK, make an appointment for a month's time.
Bye-bye.
Right, thank you.
I'll have a seat.
Thank you.
I'm Dr. Jewell.
Hello, Dr. Jules.
I hope I'm not wasting your time, but it's just people keep telling me to come and see you because I've got this mysterious mole that suddenly appeared at the back of my knee.
So let's ask the standard question. Is it bleeding?
No.
Itching?
No.
But it's new?
It's new and it's...
But you don't, because if you have many moles...
No, not really.
The average number is 40.
Is it?
Yeah, so most of us have got a collection.
Oh.
So let's have a look at it.
It's this one, so it's at the back of my left leg.
Ah, at this point I have to do something which is fraught with risk.
Oh, hello.
Get down on my... Is it this thing here?
Yes.
Okay,
well, there's
that's-
a cysty thing as well.
Have you looked at them?
I can't see them
So
really.
which is the one that everyone's worried about?
The one that's actually coloured and looks like a mole.
Well, you've got 3, 4 of those.
Oh, well, there you are. You see, I can't even see them, so I didn't know.
These are obviously, quite obviously, warts. Because what they're doing...
That's horrible.
Look, what they're doing is when you bend your knee, you're spreading them. I think the sensible thing to do is to take a photograph of them.
I've done that. I did it the other night to have a look because I knew I was coming to see you.
You know, check it again in a few months' time.
It was quite hard to take, actually.
Oh, I'm not suggesting you surely can get somebody else to take it, can't you?
Could do. Hello, would you like to take a picture of my mole?
I don't really have any other suggestions because they look completely normal.
Okay.
All right.
All right, so that's it then.
Yeah. And do come back if you're worried. You know, whatever you do, don't let concerns about wasting anybody's time deter you. That really, you know, this is a 5-minute business. It's taking a bit longer, but
all right.
It's not a big deal at all.
Okay, well, thank you very much for reassuring me.
Good.
And
Okay.
have a nice day,
Thank
as
you.
they say.
Bye-bye.
Bye-bye.
Come and have a seat. I'm Dr. Barnard. I don't think we've met before, have we?
Before. Basically what it is, I'm a diabetic.
Yes.
And I got I got a blister to my little toe and the next toe.
Yes.
Underneath, and I think it's got infected. Because it's really sore, I can't walk properly, and there's like a red line just starting to go up there. It's not the first infection I've had in my feet before. It's...
Oh, goodness, that looks
really sore.
quite nasty, doesn't it?
Yeah, it's very sore.
How long's it been going on for?
It's only started getting red and swollen past 2 days, and that line just showed up this morning, but it's been sore for a week.
Right.
But I didn't think it was infected because I kept it clean and stuff like that.
Yeah.
But it's just, I think my toes swollen as well, and that line's coming up, which is worrying me a bit.
And are you under podiatry or anything like that? Have you been in the past?
No, because I don't like people touching my feet. I hate it.
Okay.
I can't bear people touching my feet.
Can I have a look?
Yeah. I mean, it must have been the one on this toe I left a bit too long and it got very nasty.
Pull that toe back for me.
This one?
Yeah. It's really painful, isn't it? Put your foot back down again. Fine. OK. That looks really sore.
It is sore.
Because you've got the diabetes, we have to be really careful, because you know if we leave foot infections untreated or not properly treated in diabetics, it can be quite serious. Can I touch your feet to see what the pulses are like?
Yeah. Both feet?
If it's too much.
No, it's okay.
Is that very sore?
Yeah, that is, yeah.
OK. Patients with diabetes are at increased risk of having problems with their feet. This is because the diabetes may reduce the blood supply to the feet and may affect the sensation. This means that patients may not notice when they've got a sore foot or an injured foot. If it is not treated promptly, the patient is at increased risk of having a serious infection and ultimately, in the worst cases, at risk of amputation. What I'm going to do is I'm going to give you some antibiotics. We're going to get you booked in with the nurse to get it dressed and things, and then I'm going to have a look at referring you to the diabetic foot clinic.
Okay.
If I do that, will you go?
I promise you I'll go, because I don't like people touching my feet, but I don't want to lose my feet either.
More than anything, we need them just to look at it, keep an eye on it.
Thank you so much.
So look out for the appointment, but if there's going to be anything different, and they're just going to give you an appointment straight away, I'll ring you.
Thank you so much. Thank you.
OK, bye.
Bye.
There we go.
Thank you.
Right, do have a seat there. Hello.
Cheers, hiya.
Hi, I'm Dr. Bolam. All right. What can I do for you today?
Well, it's been coming on about 3 weeks now, this lump. It started off, well, didn't even notice it really, and then gradually, it's not got any bigger. It kind of, if anything, spread slightly.
Yeah.
But it's just fluid, I guess.
Yeah.
But I thought I'd leave it a few weeks and it'd probably go away.
I know exactly what that is.
Right, yeah,
Okay, it's a bursitis. Okay.
Yes.
So we all have fluid-filled sacs around our joints called bursae.
Right.
Okay, which can get swollen all of a sudden, okay? Usually caused by repetitive trauma. So that one there, people get them on their knees often. Anybody can get it.
I got you.
So that's an olecranon, that one, over the outside of the elbow. All right? Is it painful?
No.
No, not painful.
Maybe if you put pressure on it, like lean on it or something, it might be annoying.
They can get infected, but it doesn't look infected, so we don't need antibiotics,
Oh,
all right?
Okay.
Usually, the first line is to take an anti-inflammatory,
Yeah.
right? Get something to compress it, so go and buy yourself an elbow support from the chemist, all right?
Okay.
Put ice on it, and it usually just goes away, all right?
Brilliant.
And only if it gets red and hot and horrible do we need antibiotics, and we're not at that stage at the moment, certainly. All right? Yes, have a little read of this.
Yeah, sure, thanks.
Tells you how to treat it.
Well. I lost a wife coming up 5 years August, and seeing her in conditions that she was in, it does tend to make you...
Yeah.
I mean, I don't come to the doctors very often at all, but it suddenly... you think, well, one thing, keep on top of
yes,
it, you know.
I can absolutely assure you that's nothing.
Ah,
serious,
lovely.
100%,
All right.
actually.
Thank you very much.
All right,
putting my mind at
okay.
ease.
All right, okay.
Thank you, Doctor.
Okay, have a read of that.
Yeah.
Do what it says.
Yeah, thank you
All
very,
right,
very much.
Is that okay?
Yes, thank you,
All right,
Doctor.
okay.
Cheers now.
All right, have a nice day. Bye-bye.
Bye. It's all right, I got a bit of OCD as well, don't worry. It's not worth talking about, I just handle it.
All right. Okay.
Bye, thank you.
All right, bye-bye.
Hey, how's it going, Mum? Oh, hey. So I came here like a few weeks ago because I had like a problem and it felt like there was like a lump in my throat whenever I was trying to breathe in. And I'm not too sure if it's all connected, but like you see last night I basically couldn't get any sleep at all because I've got like this mad stabbing pain here. And then it sometimes can feel like a sensation up here. I got given omeprazole and another thing, and maybe cooled it off a bit. But because like I've run out of that now, it's kind of like starting to get this neck sensation thing again.
So the problems up here have been going on for a few weeks.
Yeah.
Better with the medication to some degree.
Yeah, so like...
And then that's finished.
Yeah, to be honest, it's like last night I had like an episode, I'd say, where it was really at its height and I could really feel it. I guess that's been able to suppress it to some extent, I guess.
Do you smoke?
It's maybe smoke twice at night usually, do you know what I mean? Like, that's it, I don't really smoke during the day.
Alcohol?
I don't really drink that much, to be honest. I'm not really a big drinker at all.
Caffeine?
Coffee a lot at work. Like a lot of coffee at work, actually, I guess.
Let me examine you. So we're going to start at the top by looking in your throat. Say ah.
Ah. Ah.
It all looks normal in your throat. Now let's lie you on the couch and examine your tummy. If we lift your shit up.
Sometimes, like, when I was lying down last night, they'll just feel like a pain there, like, do you know what I mean? And you're moving about. And like, even if I move, like, sat up like this, I'd be, like, aware of, like, oh, this kind of...
Okay, perfect. There's a good chance that the two symptoms, the odd feeling up here and the discomfort down here, are interlinked.
Right, yeah.
What most commonly interlinks those two things is stomach acid. So sometimes when you get excessive acid production, it's uncomfortable around where your stomach is.
Yeah.
But also you get acid coming up and irritating your throat, and that can happen while you're awake, but also at night when you're asleep. The medications that you had, one of them was to suppress acid production. I think we should try a slightly longer course of the omeprazole. So rather than 2 a day for a short period, 1 a day for a little longer. Now, while you're doing that, I think a couple of lifestyle changes. We know that caffeine and nicotine are quite irritating to your stomach. Cutting out caffeine and trying to cut out the cigarettes will probably make a difference to the symptoms and allow your stomach to
get healed. Yeah. Totally. Yeah, that's okay. Thank you very much. Anyway, thank you very much for your time, man. Cheers. Thank you very much. Cheers, man.
Come on in. Have a seat. I'm Dr. Graham.
Hello. So last time I think had a water infection.
Did I?
I think this is a cyst, and I think it's getting infected.
Okay.
It has been once before, and Dr. Lee said she didn't want to cut it out because it's right on the jugular. But over the last few days, it's hurting.
Yeah.
It didn't hurt last time, but it is hurting.
And has it changed as well as being painful? Is it bigger or?
It's bigger and harder, and it feels a bit warm.
Okay.
But I just know it's just... No, I feel a bit sicky, but I don't know if that's just... I don't know. I've got a job interview tomorrow, so I don't know if I feel sick because of that or if it's because of that.
Yeah, okay.
But last time, not at all did it hurt, and it just oozed horrible pussy stuff.
And nothing's come out this time?
No.
Okay.
No, so I don't...
Should we just take your temperature
Okay.
first? That's fine, 36.1, so that's normal. Just take your pulse. What's your job interview?
I work in a school anyway as a teaching assistant, and it's in the same school but for a different teaching assistant role.
Okay.
So yeah, I'm just a bit nervous. It's ridiculous.
Do you want it?
Yeah. I just think it's horrible when you work there and you have to have an interview with people you know. Yeah.
Difficult, isn't it?
It is horrible.
Okay,
yeah.
let's have a look. I'll just put some gloves on.
Okay.
Yeah, it has got a little head on it, hasn't it?
Oh, I don't know, has it? Okay.
Little white bit.
Yeah, so maybe it is then, because it doesn't usually have a head on it.
Yeah, that's how big it is. And it's a bit red up there as well.
Yeah. And that is sore when you touch
so
it.
I don't think you should try and squeeze it.
No, I won't.
Okay?
No, I won't.
And
no.
hopefully it'll get better with some antibiotics, which I think is what we should do. Yeah?
Yeah.
So we normally give 5 days of flucloxacillin, okay?
Yeah.
4 times a day. And if it's obviously getting worse, then you come back. Or if you feel ill, like you're being sick or something. It's basically a sebaceous cyst, which is part of the hair follicle that's got a bit blocked and caused a lump, and then that is prone to getting infected. So it's really common and not anything surprising, to be honest. As this is the second time it's happened, you could discuss with Dr. Lee whether she'd be willing to remove it. But I can see why she's a bit reluctant.
She's a bit anxious about that, I think, and that's fine. I don't want to,
Well, you don't want
it's
things
a bit risky. Yeah.
Exactly. Is that all right?
Yes, of course. That's absolutely.
And good luck tomorrow.
Thank you very much.
That's all right.
Fingers crossed.
Yes. Bye bye now.
Thank you. Bye bye.
Come on in.
Thank you.
Have a seat. How can I help?
It's my right kneecap.
Okay.
I'm all right doing long walks, but when I stop, it seizes up.
Right.
And I have to let it rest for a while before I can... And if I start walking it straight away, it hurts.
Yeah.
I can kneel down on this knee, but I can't put this knee down properly.
No. Can we have a look at your knees? Do you want to just pull up? And could you do that with the other one as well, just so I can compare them? That's it. You can see that it's a bit swollen up there, can't you? And if I just have a press around that side, that's okay?
Yeah, it's fine.
Round here? Does it actually hurt if I press there?
No.
Okay. And if you fully straighten it, does that hurt? No? Bend it? Straighten it? Well, that's pretty good, isn't it? And if you just move your knee just so that your ankle's there, yeah. And I'll just give it a bit of a test. It's quite stable, isn't it? Yeah, good. OK, you put your trousers back down then. Your knee is taking quite a lot of weight at the moment because it's the main joint that carries you around. Have you had thoughts about losing quite a bit of weight at all? Any thoughts about I mean, I think it would really help with what you're here for today.
Think about trying the Weetabix diet.
The Weetabix diet? So what's that one?
Just Weetabix 3 times a day and that's it. And
Really?
then you play with your fruit.
Right. Sounds a bit crazy to me. What do you think about it, really, the Weetabix diet?
I think it's all right.
Yeah? I mean, do you know how people successfully lose weight?
Well, you've got to mix the exercise and the healthy eating.
Yeah.
sides.
Most of losing weight is simply eating less. So I actually say that most people who successfully lose weight just say, I'm going to change the way I'm going to eat for the rest of my life. Because a lot of people do these diets, like a Weetabix diet, and unfortunately, when they go back to what they normally do, they just put the weight back on. So sometimes I suggest to people they just reduce the quantity, because quite often, quite a lot of us are eating more than we need to.
I have breakfast. Sometimes I have lunch.
Yeah.
That I do have for dinner.
Yeah. People who eat breakfast are in general thinner than people who don't. And people who eat a small regular meal 3 times a day are lighter than people who don't do that. Your body is sort of needs regular eating. We all eat our main meal in the evening in this country. And the problem with that is that we're having a lot of calories and then we go to bed. And actually, when we need the calories is the morning and the lunch, and much less in the evenings. If there's any way that you can change that around and have your main meal at lunchtime, that's supposed to be healthier.
Okay.
If you wanted some more help about losing weight, then you could book maybe to see one of the practice nurses or something along those lines.
Okay.
Is that all right?
Yeah.
Okay.
Thank you for that.
That's all right. Nice to see you.
Nice to see you.
Bye now.
Bye-bye.